All right, thanks, Wayne. Well, every 35 seconds, an American dies of heart disease. If your family has a history of heart attacks or stroke, you are twice as likely to have one yourself. Well, now, for the first time in medical history, one test can predict if your genes are putting you at risk. Linda Hurtado has more in her Taking Action for Your Health report.
My father's father died at age 58 of heart disease.
My mom, on the other hand, died of congestive heart failure.
My paternal grandfather died of a heart attack. My mother had a heart attack probably in her late 60s.
3 people, one thing in common. Heart disease has killed members of their family.
In the back of my mind, I feel like I'm a little ticking time bomb.
The odds are not in Holly Roche's favor. She knows her DNA puts her at risk, but what she didn't know, genes change over time, and so can her risk of a heart attack.
When somebody's healthy, they may not have expression of certain genes, but when they're sick or when they develop heart disease, they may get an increased level of expression of certain genes.
Vanderbilt cardiologist John McPherson is one of the first doctors in the country to give a one-of-its-kind blood test that reads a person's genomic expression.
What this test does is it actually measures the levels of expression of different genes, which can change over time.
43-year-old Larissa Jennings has been feeling tightness in her chest. Her mother, father, and grandmother all died from heart disease.
As you can see, I'm a fluffy, as my family say, person.
It's very important that we make sure that she does not have coronary artery disease.
The test measures 23 different genes focusing on the white blood cells. They're called inflammatory cells because they're activated when plaque builds up in the arteries. Measurements under 25%, low risk. Above 50%, high risk. Larissa's results, she had an 8% likelihood of obstructive disease. Holly's risk, low as well.
It is a great sense of relief.
Every time I feel a little twinge, or maybe I feel a little extra beat or a skipped beat, I'm not going, oh my gosh, I should stop now because, I don't think there's anything to worry about, at least not right now.
A discovery that could someday alert millions of people who are unknowingly at risk. Taking action for your health, I'm Linda Hurtado, ABC Action News.